Hello, welcome back to On the Couch with Nikki, where I bring you experts for expats. This episode is brought to you by Expat Dental, where you can speak to an experienced dentist about all the teeth straightening options for your children. So, who's with me on the couch today? Many of us suffer from back pain, whether it's muscular or disc related. I have Diana Mecklenburg back with us from PhysioActive Physiotherapy Clinics to talk about how we can get some relief. Let's talk. So the people that come in and complain about back pain, what do you notice is the main thing that they're doing wrong?
Normally it's the wrong usage of the muscles. They overuse normally the back muscles. Hamstrings are a lot of times way too tight, so they pull on the pelvis. The abdominals are very, very, very weak. And the core is not really active because they probably already had an episode of back pain, and as soon as you had an episode of back pain, it's very normal for the muscle to just kind of cope. Yeah, and when you cope, you normally use your back muscles more than actually your abdominals.
Wow, I'd never had linked hamstrings with the back, but that kind of makes sense. It's not one isolated area that we're talking about here, it's just the whole body as a whole and everything working in together to help support and strengthen the back.
Yes, and also what's very good to know, your lower back is kind of the center of your body. There's pressure coming from the bottom, there's pressure coming from the top. If the lower back doesn't function properly, your whole body doesn't function properly. So it's really a head to toe examination and see what needs to be changed.
What are some amendments that people can make to their lifestyle that might avoid this happening?
Okay, so one thing that's very important is exercising. So you need to exercise your core muscles, which is a gentle internal muscle. And you need to exercise the outside muscles. So that means your six pack, your obliques, that are your side muscles, and your back muscles. They all need to be able to work together. It's not just the core, it's also the outside package. If one is not functioning correctly, pretty much the whole card house collapses. And then you can create back pain. Stretches that are very important, and then of course posture. Posture in standing and sitting is really important.
Okay, so how can people improve posture?
So when you sit, you actually want to really slouch down and then really arch your back. And then when you find the middle of those two, you're probably in a very good position.
Okay, and crossing legs, a no-no?
Crossing legs, as long as you change and have both legs next to each other, it's okay. But if you cross your legs the whole day,
one way,
it's not good.
Okay.
And what I've heard from my patients, that a lot of patients also cross their legs on the chair.
Oh, sitting cross-legged on a chair, not
so
good.
Then they really slouch in the lower back, which causes a lot of strain on your lower back and on the discs.
What about some lifestyle changes that we can do to make sure that we're not susceptible to back pain?
For example, don't take the elevator to your home or to your office. If you live very high, just take the last 2 flights.
Okay.
Yeah, just climb stairs, be a little bit more active instead of taking the bus. Maybe walk 1 bus stop and then take the bus. These are very simple things that you can already change and be a little bit more active. When you're in the office, ideally it would be that when you just move a little bit on your chair every 30 minutes and maybe every 1 to 2 hours really get up and walk around a little bit. So grab a coffee or a cup of water.
Okay,
Yeah.
So exercise if we can, do some flexibility and stretches where possible, remain active when we're at work, just sitting.
Yes.
Sit cross-legged, balance it out. So if somebody feels as though they've got back pain, should they be icing or should they be heating?
It used to be if you have an acute back pain. It's kind of like you bend forward, you want to come up and you pretty much collapse. It's so painful.
Yep.
Most people are much better with ice because it really calms down the pain.
Yeah.
If it's a much longer lasting back pain, you really feel like it's a bit stiff, it's a bit achy, then normally deep heat is much better because you want to increase the circulation.
Yes.
So you want to open the blood vessels to actually relieve the tension in your muscles.
Okay, and what would a physiotherapist do to help?
Yeah, so what we do is actually generally look at the position of your pelvis, if there's any leg length difference, if the muscles are too tight on one side, it's lifting up the pelvis a little bit, looks at the curves of the spine, and then we're going to check your movements. If there are movements that are not going as well, if you're actually using all your vertebrae in your spine or skipping to protect the pain.
Yeah.
If your muscles are too tight, and then we're going to mobilize the spine. If we need to deep heat and massage the lower back. And then we're going to teach you the right stretches, the right strengthening exercises, and the right posture.
So the idea is that you don't need to keep coming back to the physio. You
That's
sort of arm
right.
people with the tools necessary so that they can avoid coming back.
That's right.
Most people have their preferred position they like to sleep in. What's the advice that you would give on the preferred sleep position?
So it's very difficult to change your sleep position. Sleeping on your front while you have a back pain and you say, my back pain gets worse at night, we really are sorry, don't sleep on your front. Yeah?
Okay, so no front sleeping.
Preferably not. Yeah? Sleeping on your back can actually also increase the lower back pain, because as soon as your legs are flat and straight, you're actually tilting your pelvis, which causes this little bit of air pocket in between your lower back and the mattress.
Okay.
And it keeps your lower back muscles really, really, really tight. And then you get very stiff and very painful in your lower back. Just to change it, prop a pillow underneath your knees. Yeah,
okay.
It just sinks your lower back more in the mattress and you can still sleep on your lower back. Sleeping on your side, especially when you get more pain in your leg, you want to have a pillow in between your knees so that your leg that's on top is really leveled with your hip. The only problem that we then see is, especially with women, when they have a very narrow waistline, as soon as they sleep on their side, their waistline is going to sink. So what you get is another curve into the spine. If that gets sore, you need to prop a little towel or a little pillow underneath your waistline so that your spine is in a straight line again.
So you could roll up a towel, and because people generally swap sides.
Yes.
So if somebody didn't mind which way they slept, which would you say is the preferred way?
Side sleeping.
Side sleeping.
Yeah.
Okay, because people will naturally go back to
around.
where they want to go in their sleep
Yeah.
anyway.
Yeah.
Mattresses.
Yes, so it depends a little bit on your weight. Normally when you're a little bit heavier, you don't want to go too soft, but you also don't want to go too hard. So then you're more in the medium firm.
Okay.
Yeah? When you're very, very light, then a softer mattress is actually better for you. Yeah, because then it sinks in a little bit more to your curves.
Yes.
Yeah? And if you're very, very heavy, then you need a little bit harder mattress. Yeah, so it depends a little bit on your weight, but still, you have to lay down on a mattress and say, this is it. When you lay down on your back, you should actually feel the mattress is covering your lower back a little bit. When you're on your side, you should feel that your hip is sinking in a little bit and your shoulder is sinking in a little bit.
Okay. What about memory foam?
A lot of mattresses nowadays have kind of a firm mattress with a top memory foam
Yes.
on top. Yeah, that is normally a little bit better than the whole memory foam.
Pillows.
So if you would ask me, would you like those shaped ones? I would say no, because it's very, very difficult to get the right curve for your personal neck.
I suppose with pillows it's trial and error. If you're waking up and your neck's sore because of the pillow, change pillows and just
Yes.
experiment a bit.
Yes, so it's very difficult. Normally, as I said, take a little bit less than shoulder width, yeah, and then depending on you, a little bit harder, a little bit softer. If you feel when you're on your side, you should actually feel from head till your glutes, it should be one straight line.
If people just have mild back pain, what should they do? Go to a physio and get onto it, or just do some exercises at home first?
Well, if it's just the first time they get a backache and it's not that serious, they just feel like, oh, I just made a wrong movement or I just slept wrongly, it should be gone within 2 days. Yeah. If you then still feel like it doesn't feel good, then you can see a physio.
Prevention is better than cure. Go to PhysioActive and get your spine looked at. Make sure that you've got correct posture, work on your muscular strength, general movement, flexibility, everything that we covered off in the episode, so that you can live without back pain. Thanks everyone.